Part D of Medicare is something I get asked a lot of questions about. It can often be one of the most confusing parts of Medicare to understand. Today, I'm going to break down how Medicare Part D works. We'll be talking about the donut hole or the coverage gap as well, and whether or not that's something you need to worry about. So stay tuned. Hi, my name is Stephanie Apt. I am an independent insurance broker, and I specialize in helping seniors all across the country to navigate the world of Medicare. I try to put out videos about all of the different parts of Medicare as well as Medicare plans. And if you find value in the videos, I'll ask you to take just a second and subscribe to the channel. You can like the video and be sure to leave your questions in the comment section below. I love to read those and I'll be sure to reply. Medicare Part D is the part of Medicare that covers your prescription medications. And you can get Medicare Part D benefits either through a standalone Medicare Part D prescription drug plan or through a Medicare Advantage plan that includes prescription drug benefits. Either way, the Part D coverage you get will be pretty similar. Medicare Part D has different coverage levels or phases and includes a coverage gap or a donut hole. So today I'm going to talk about how that all works. We're going to break down the different Medicare Part D phases of coverage and how those work. We'll talk about the donut hole or the coverage gap and whether or not you need to worry about it. And finally, we'll talk about how to find the best Medicare Part D plan to cover your specific medications and meet your specific needs. Medicare Part D plans all have different phases of coverage. So there's a deductible phase, there's your initial level coverage phase, there's the coverage gap or the donut hole, and then there's the catastrophic coverage phase. It's important to know that Medicare Part D plans are calendar year renewable plans. So every Part D plan renews and resets every January 1st, including the phases. And most Medicare beneficiaries will only ever get to that first or second phase in a given year. When it comes to insurance, the deductible is the amount that you have to pay out of your own pocket before the insurance kicks in. So for Part D, this means that you'll have to pay the full cost of your medications until you've met that plan's deductible before the Part D plan is going to kick in. In 2020, the standard drug deductible for Part D plans is $435 per year. Now, some Part D plans have lower deductibles and some have $0 deductible, but the vast majority of Part D plans have a deductible of about $435 in 2020. So a lot of people's reaction to that is, what? That is a high deductible. I'm not even taking that many medications. I'll never even meet that deductible. The good news is that many Part D drug plans, even if they're showing that they have a $435 drug deductible, actually have a $0 deductible on your lower level generics, like your Tier 1 or Tier 2 generic medications. So if you're taking only Tier 1 and Tier 2 medications, it's very likely that that deductible may not even apply to you. However, if you're taking a brand name medication, or in most cases a Tier 3 or higher, then you will have to pay the full cost of that medication at the pharmacy before your drug plan kicks in. And remember, deductibles reset along with your plan every January 1st. After this deductible phase of coverage comes your initial level coverage phase. And this is generally the phase you want to stay in. So after you've met your deductible, now when you're in the initial level coverage stage, you're just going to pay a set copay or a set coinsurance amount that's been established by your drug plan for your specific medications. The amount you pay will depend on which tier your medication falls under, and the tiers have been established by the drug plan, and they can vary a little bit from one drug plan to another. Because these tier categorizations can vary a little bit between Part D drug plans, we recommend using your drug list to shop every year and find the best Part D plan for your specific medications, and I'm going to talk about that some more in a little bit. After the initial level coverage phase comes the donut hole. Now, there's been a lot of talk about the donut hole is closed, or the donut hole is supposed to close in 2020. But really, there still is a coverage gap, and most people think of that as the donut hole. So whether you want to call it the donut hole or the coverage gap, I'm going to break down what you can expect your medication costs to be if you get to this coverage phase during the year. Now, keep in mind, most people will never reach the coverage gap phase of coverage. Recent studies stated that only about 10% of Medicare beneficiaries actually reach the donut hole or the coverage gap. This coverage gap comes after a certain spending threshold. The spending threshold dollar amount can change, and in 2020, the spending threshold is $4,020. And that is the spending limit that gets you into the coverage gap. So every month when you refill your medications, you're going to your pharmacy and you're paying a certain amount for your medications, and the insurance company is paying the rest. Once the total amount that you and the insurance company together have paid equals $4,020, you've reached that spending threshold and you're now in the coverage gap phase of coverage. And when you're in the coverage gap, in general, you're going to now have to pay 25% of the cost of your medications. And that comes off of the price that your insurance company has set with the pharmacy that you use for that drug. So let's say, for example, you're taking a medication that has a $400 retail price, and you are in the initial level coverage phase paying maybe a $45 copay for that medication. Now that you're in the coverage gap, you will have to pay 25% of the cost of that medication, which equals $100. So now you're paying $100 for this medication when before you were paying $45. So you can see that your drug costs can really jump when you're in the coverage gap. The items that count towards getting you to the coverage gap are any amount that you've paid into your deductible, your co-pays, and your co-insurance for your covered medications. Things that don't count towards getting you to the coverage gap would be the monthly premium that you have to pay for your drug plan, any amount that you pay for medications that aren't covered, and any amount that you would pay for medications that are at a completely out-of-network pharmacy. Now, some Medicare beneficiaries will actually come out of the coverage gap and get to the final coverage phase, which is called catastrophic coverage. This part gets a little bit tricky. Once you've spent $6,350 in 2020, you are now in catastrophic coverage. The reason it gets tricky, though, is that in order to get to catastrophic coverage, Medicare only counts the costs that are going towards your TROOP, which stands for your true out-of-pocket or your total out-of-pocket. These are examples of the out-of-pocket costs that are counting towards your TROOP, or your true out-of-pocket. So these are the costs that will help you get to the catastrophic phase of coverage. Any amount you've paid into your deductible, your co-pays and co-insurance when you're in your initial level coverage phase, almost the full cost of the brand name medications that you've purchased during the coverage gap. But for generic drugs, it only counts the amount that you've paid for the medications in the coverage gap, not the full cost. Once all of these costs add up to $6,350 in 2020, you're now in the catastrophic coverage phase. And in this phase, generally your prescription drug costs go down. In this phase, you'll only pay 5% of the cost of your medications, or $3.60 for generic medications, or $8.95 for brand name medications, whichever is higher. The coverage gap is pretty lousy and no one's ever happy if they get there. It is better than it was in years past. It used to be when Medicare Part D was first established that you had to pay the full cost of all of your medications when you were in the donut hole. So how can you avoid the donut hole? Well, I'm going to share some tips with you. The first and most important tip is to shop your Medicare Part D drug plan every year. As I mentioned earlier in the video, different Part D drug plans can categorize different medications into different tiers, which can in turn determine how much you have to pay for the cost of your medications. Additionally, there are certain Part D drug plans that offer more coverage during the coverage gap than others. If you're going to fall into the donut hole, it can be hard to avoid. However, there are some plans that can reduce your out-of-pocket costs. So you definitely want to actively shop your plan every year. And that's something that we do as a free service for all of our Medicare Supplement and Medicare Advantage clients. And I'm also going to link a video in the description below that shows you how to shop and find the best Medicare Part D drug plan on your own using the Medicare.gov Plan Finder tool. Another tip is to pay cash for some of your medications if the costs are low enough. Now, if you pay cash for your medications instead of using your Medicare Part D drug plan, those costs will not count towards that spending threshold that gets you into the coverage gap. So it's always a good idea to ask your pharmacy what the cash price would be for that drug and see if it is the same or maybe less than what the set copay or coinsurance amount is that's been set by your Part D plan. There are many pharmacies like local grocery stores that offer very, very low cash pay prices for generic medications. So it's always a good idea to check there. You also could try using websites like goodrx.com to find free coupons for your medications. And Blink is another resource that you can look into. And these websites and resources offer you free coupons to get pretty big discounts on certain prescription medications. So if you're taking a lower level generic, you can sometimes find that the costs are lower if you pay cash or use one of these coupons than if you use your drug plan for that medication and have it be counted towards your total out of pocket to get to the coverage gap. In general, Medicare Part D can be kind of complicated depending on what medications you take. However, the good news is that you can change your Part D plan every year. There's an open enrollment every fall. It's called the Medicare Annual Election Period, where you can change your Part D plan and choose a new Part D plan, and that's between October 15th and December 7th. If you have more questions about Medicare Part D, be sure to check out the links in the video description below, and you can always feel free to call or email us at any time. Thank you so much for watching, and we'll see you soon.